Thank you, Chairman. I would like to talk about the efficacy of vibegron, a new selective beta-3 agonist on urgent urinary incontinence with overactive bladder. This is my disclosure. We have reported that vibegron, a new beta-3 agonist, showed the efficacy and safety in the treatment of OAB in Japanese phase 3 study. Vibegron has already launched in Japan last November. The present study was post-hoc analysis of the phase 3 study to evaluate the efficacy of vibegron 50 mg and 100 mg and placebo on urgent urinary incontinence (UUI) in OAB patient. In this analysis, the patient with UUI based on the bladder diary was selected. The patients were divided into two groups. One is a mild, moderate UUI subgroup, in which the patient had less than 3 UUI episodes per day. And the other is severe UUI subgroup. The patient had 3 or more UUI episodes per day. The change from baseline to week 12 in UUI episodes per day, daily UUI dry rate, which is the percentage of patients who became UUI-free, and the response rate of PGI were evaluated. In the both UUI severity group, there are significant difference in the patient characteristics at baseline among the 3 drug groups. The number of UUI episodes per day was 1.5 in the middle to moderate subgroup, and 4.5 in the severe UUI subgroup. As you can see, the number of the UUI episodes were significantly improved in the vibegron group as compared with the placebo group in both mild to moderate and severe UUI subgroups. Daily UUI dry rate in vibegron group was significantly higher versus placebo in both severity subgroups. This is a response rate of patient global impression PGI. Percentage of the patient with PGI score 1 feeling much better or 2 feeling better at week 12 was defined as a response rate. The rate in the vibegron group was significantly higher versus placebo group in both mild to moderate and severe UUI subgroups. In summary and conclusion, in the present study, treatment with vibegron 50 mg and 100 mg for 12 weeks significantly reduced UUI episode versus placebo. The daily UUI dry rate and the response rate in vibegron group were significantly higher compared with placebo group. The UUI dry rate was about 60% in patients with mild to moderate UUI and about 35% in those with severe UUI. In addition, 50 to 60% of the patients felt better or much better after 12-week treatment with vibegron. The present result suggests that vibegron might be useful for treatment of UUI in OA patients regardless of UUI severity. However, the present study was post-hoc analysis, therefore further prospective study will be needed. Thank you for your attention.